Hi, I'm Dre, the host and founder of the Dragon Network. For the last few videos, we've been talking about some of the healthcare standards that exist for clinical data exchange. I thought we'd continue that conversation and focus on a group of standards that are incredibly relevant to the COVID-19 pandemic. So with COVID-19, one of the most critical aspects of healthcare workflow is the global supply chain. Whether we're looking at the acquisition and distribution of PPE, or the expansion of hospital services to incorporate more critical care beds, the supplies become an integral part in actually responding to this pandemic. And now, in addition to the PPE and critical care expansion requirements, we also have the acquisition and distribution of the Pfizer and hopefully soon the Moderna vaccines. So the group of standards that actually comes into play with the healthcare supply chain are GS1 standards, and these really represent the development and maintenance of business communication standards. So GS1 standards are not unique to healthcare, they're used across all industries, but there is a small subset that has been ratified for healthcare use. So let's take a look at where it got started. So way back in the 1970s, a group of US industry leaders got together and decided that they needed a standard for product identification. The standard that they agreed upon was a 12-digit Universal Product Code, or a UPC code, which eventually was expanded to 13 digits to allow for global expansion. So that original 13-digit UPC code is now commonly referred to as the GS1 barcode. As we got towards the end of the 70s, in 1977, the European Article Numbering Association, or the EAN Association, opened the first GS1 office in Brussels. So the focus of the office and all of the individuals that were working on things was to improve the general efficiency of the global supply chain. So they focused on general supply across all industries for the first several years, and it wasn't until 1995 that the first healthcare standard was introduced. So if this pandemic would have occurred just 25 years ago, we wouldn't have had all the standards that we have in place right now to track the supply around the world, which has become so useful and so instrumental in actually getting everything distributed properly and having us plan our vaccine rollouts to the level that we can. When we're looking at the GS1 standards, there's four main categories that they fall into. And those four categories are identify, capture, share, and use. The identify category includes standards which are commonly referred to as the GS1 Identification keys. So these are unique identifiers that refer to things like locations, documents, items, service relationships, etc. There are 12 GS1 identification keys in total. Some of the examples are GTIN, or the Global Trade Item Number, GLN, or the Global Location Number, GIAI, the Global Individual Asset Identifier, and GMN, which is the Global Model Number. So the second group that we have of GS1 standards is actually the Capture group, and this group is focused on any standards that would be required to help automatically capture relevant information as items, objects, and services travel throughout the supply chain. So in this category, we have barcodes, electronic product codes or EPC codes, as well as radio frequency identification tags or RFID tags. The third category is actually the share category. This category is focused on the standards which help in item master data, in communication and transaction data, as well as physical event data. So anything that is actually relevant to the sharing of information as something moves through a pathway. If you take a look at this slide, you'll actually notice that the GS1 standards within these groups get broken down into very granular components. So if we look at the identification group, for example, we've got standards that actually are going to identify everyone from manufacturer to end consumer. So including things like the item, the case, transport, distribution, and everything in between. They're all part of that first category, which is the key identifiers. So the second group, or the capture group, includes standards associated with numerous different types of barcodes. So you may be familiar with standard UPCs or with QR codes. So you've also got UHF identifiers, anything that would be utilized to scan or capture information and needs something to be embedded within the capture code. So the data exchange is focusing entirely on interoperability, and it actually is looking at the components that you're going to share between systems, or as something moves throughout the process, what data would actually be transmitted across, so that's going to make sense. So this graphic by GS1 is actually a good illustration of all of the options that are out there. So finally, we have the fourth category, which is the use category. So the use category is actually focused on the business processes and the drivers behind combining all of the other three categories together. So it's looking at the layer and any standards that may be required to actually make sure all of those components are going to work in tandem. So with the first three categories, you actually have groupings of standard types. And with this fourth one, you're actually looking at how those standard types are going to work together to form an end-to-end business process. From a governance perspective, GS1 is a global organization with more than 100 member organizations that are participating. In the healthcare sector, there are actually more than 60 that are specific to the healthcare realm, but the governance of the overall organization is set up with three distinct layers. So we've got the General Assembly, which is comprised of representatives from each of the member organizations. And below the General Assembly, we've got the GS1 Management Board, which is a group of key leaders that actually represent some of the member organizations, as well as leaders in some fairly significant global businesses. So some of the businesses, for example, that currently sit on that management board are Google, Nestle, Wendy's, the College of Physicians and Surgeons of Canada, just to name a few. Finally, we have the third layer, which is the GS1 office, as well as the GS1 local member organizations, or MOs. So it's this layer that's responsible for actually developing and maintaining the new standards, and they bring things forward through the process to get ratification. So there are GS1 offices or GS1 local divisions in a number of countries, including one in Canada as well as one in the United States. With respect to healthcare specific standards within the GS1 groupings, we have 4 that have been ratified so far, and I'll put links to each of those 4 in the links below so you can dive a little bit deeper into them if you'd like. And those are the G10 allocation rules for healthcare, the Global Traceability Standard for healthcare, the Application Standard for Products in Clinical Trials, and the GS1 Pharmaceutical Clinical Trial Electronic Messaging Standard. So one of the key things to note with the GS1 standards is there are still a number of organizations that actually haven't implemented GS1 completely across their supply chain. And this goes all the way from manufacturer to hospital organizations. So this is something that is in progress throughout our healthcare industry and isn't actually likely to be completed for many years to come. Not all products that you'd receive into the healthcare space are actually tagged with GS1 standards, but we are starting to see more and more of that develop. And just recently, we've also seen some fairly comprehensive white papers on some of the economic benefits that we can see in optimizing the supply chain within a healthcare organization. And a lot of that does rely on the ability to track using GS1 standards. So if you're with an organization that has GS1 applied to pharmaceuticals, but maybe not a lot of the other areas, expect a lot more of this to come in the near future. So that's all I wanted to touch on for the GS1 standards. I'll put those links in the description below. So if you want to look a little bit more into it, you can go ahead and do that. And as always, if you like the types of videos that I've been posting, don't forget to subscribe to the channel and turn your notifications on. I'll talk to you again next week.